Good morning, YouTube. It's New Life for Jen, or Jen. Today is Tuesday, I believe it's the 15th, 2011. I'm coming on today to kind of document this for myself, and then maybe to see if anybody else has had similar issues that I'm having. My back was always really screwed up before surgery, and I lost, the weight, and then in August, and then it got better. Last year before surgery, they were doing MRIs and CAT scans, and I was in physical therapy, and, I was just like, they should have just told me I needed to lose weight, because once I started losing the weight, my back felt much better. I had a lot of lower back pain. Well, we went to Kings Island in August, and I rode a couple of the roller coasters, and it started acting up again. Nothing like it has been since this Saturday, but, just by the end of the evening, I would just be done. It'd be hurting. I'd be, in enough pain to where I wouldn't have to take anything, but going to bed and resetting myself, I'd be fine in the morning. So, Saturday, we drove to a friend's for a birthday party, and just being in that car for an hour and 15 minutes, I was literally almost in tears. So, it started getting really bad Saturday. Continued to progress from Saturday till today, of course. Called the doctor yesterday, and he suggested chiropractor, because now the pain is underneath my bra strap. It is not coming from my lower back, which they said is actually probably a good thing, because they might be able to fix that with a chiropractor. Because the problem is that the pills I was on before, it was like Robaxin and a muscle relaxer and pain pills, and, with this band, I didn't, I know there's people that say don't take ibuprofen and don't do this and don't do that. I take ibuprofen every once in a while just for a headache. I just make sure to flush it really good. I drink like a whole bottle of water if I take some ibuprofen or whatever. If any ibuprofen is not good for anybody, whether it is a Lap-Band patient or a normal patient. Too much ibuprofen is going to eat anybody's stomach lining away. So if you are in pain, I don't care if you're a Lap-Band patient, whatever, you just got to flush it through, the new stomach. So I don't truly believe in the no ibuprofen thing, but I don't want to be on a permanent pill fix for my back. I just want it fixed. I don't want to be taking pills for it. Because last time that's all I was doing. And that wasn't even helping it. It was just masking the problem. And I don't want to mask the problem. I want to get rid of the problem. So last night, it was really bad. I'm standing, it's okay. If I'm laying completely flat, that means with no pillow, it's okay. Heating pad wasn't helping, so I had some Excedrin back and body pills, Excedrin's in an ibuprofen, it's, an aspirin form or whatever, so I was like, well, I'm going to try that. So I made sure, and I could not eat yesterday at all. I got all my protein in yesterday just from shakes, and because my band was not having anything, and I think that's from the pain, because the pain's coming from the center of my back, which is, kind of directly in line with my stomach. So my band has been crazy tight. Sunday night, Monday, and, and now it is again today, which I'm not even trying to eat. Everything I ate yesterday, it came right back out within 2 bites. It wasn't happening. So I got all my protein in yesterday just from shakes. So last night I took this back and body pill from Excedrin. Took that at about 10:30 p.m. And by 2 o'clock in the morning, my back was hurting so bad that I was literally in my bathroom on the toilet, because my stomach was hurting too then. So I don't know if it was from this pill or if it was from my back. I was literally sweat within 10 seconds of sitting there in this pain. I was sweating from so much pain, and I had the chills. I was in so much pain. So then I'm starting to gag, like I'm going to throw up from my regular stomach, and I started flipping, because I've already just talked about this with drinking, and nothing would come out. And it felt like I would feel better if I actually threw up, and I couldn't get nothing out. And I started flipping, and then I had to tell myself, you need to just calm down, because you're just going to make this worse with your stress. So I kind of came back into the bedroom, sat down on the bed, and tried to do like a meditation kind of thing to try to just think the pain away, and, you know, it helped. I got to the point where I could lay flat again, and I fell asleep. But I'm going to tell you what, that pain last night, where I mean, it was just, I was sopping wet within 4 or 5 minutes. That's how much pain it was. And I'm just like, that pain there was considerable to when I had gallbladder problems and had my gallbladder out. It was that bad. I was this close of going into the emergency room, and I'm just like, nope, I'm just gonna, I don't know if it was from the Excedrin pill or if it was from back pain. So I don't know if anybody out there has had similar problems with back pain, with Lap-Band, and what medication you can recommend. You know, that's, I don't know if this was from that. And now I'm afraid to try the Excedrin again to see. So now I haven't done anything today. My appointment is at 1 o'clock p.m. It's 10:15 a.m. right now. So it is just the simple fact of stretching 20 all the time. It feels like I have to like stretch and pull and just keep moving my back. It is just, it's awful. So hopefully today I'll get some good news. They're going to do some x-rays. I believe I have a disc problem. My dad had disc problems in his neck. He had a fused disc. I believe I have something like that, and I don't think it's going to go away even though I've had this weight loss surgery. I was hoping it would, but I think I re-flared it back up riding those roller coasters back in August. So just wanted to get anybody's, if anybody can shed some light on what they do, because I know there's people still living out there with back problems with Lap-Band. And if anybody can give me some suggestions on what they do, like I said, I've tried heating pads, I've tried Bengay, Icy Hot, the pills. You know, I don't want to be on a permanent fix of muscle relaxers and crap like that. I'm trying to, this was the reason why I had this surgery, is to where I wouldn't have to take stuff like that anymore. But any help would be greatly appreciated. Talk to you guys soon. Bye.